Hello, friends, and welcome to The Artificial Brain, the podcast that explores the frontiers of artificial intelligence, one fascinating idea at a time. I'm your host, Shining. From groundbreaking models to the big questions about our future, we're here to make sense of it all, clearly, honestly, and without the hype. Ready to expand your mind? Let's dive in. Welcome back to The Artificial Brain. Okay, imagine this. You walk into a hospital, right? It smells like that weird antiseptic soap. You are sitting there, nervous, waiting to see the doctor. The door opens, but instead of a human in a white coat, a robot on wheels rolls in. It looks at you, scans your face, and goes beep boop. You have a sprained ankle, here is a pill. That is the future, right? Or is it actually right now? Because today we are talking about AI in healthcare. And this is not just some sci-fi movie plot where the robots take over and start doing surgery with laser eyes. Although that would be kind of sick, no cap. We are talking about real-world applications, from clinical trials that move faster than a viral TikTok trend, to personalized medicine that is literally designed just for your DNA. We are talking about the wins, the fails, and the ethical hurdles that make you go, So buckle up because we are about to scrub in.
And his name is John C.
First off, let's get real about what we mean when we say AI in healthcare. It sounds like a buzzword, right? It is giving corporate presentation. But at its core, it is just using artificial intelligence to analyze complex medical data. We are talking mountains of data. The human brain is incredible, but we are talking about data sets so massive, no human doctor could possibly sift through it all in a lifetime. AI comes in to augment or even exceed human capabilities. It can find patterns we miss. It can diagnose diseases faster. It can predict outcomes before they happen. It is low-key a superpower for the medical field. Think about radiographs, X-rays. These are the most commonly performed imaging tests in radiology. Doctors look at thousands of these a day. Even the best eyes get tired. AI does not get tired. It does not need a coffee break. It does not get distracted by a text message. It just spots the anomaly. The potential for AI to assist with triage and interpretation of these scans is massive. Imagine an AI flagging a broken bone or a suspicious nodule instantly. That is game-changing. That saves time. That saves lives.
Bill Nye the Science Guy.
But before we get too hype about the future, I want to take a quick little tangent, a little history lesson. Because AI in medicine is not actually brand new. You guys might think this is something that just popped up with ChatGPT last year. But nah, we gotta go way back. Let me take you back to the 1970s. We are talking bell-bottoms, disco, and the very early days of computing.
Hey, that's pretty good.
Enter Mycin. Now, Mycin was not a cool robot. It was an early backward chaining expert system. I know, backward chaining sounds like a yoga move, but stick with me. It was basically an AI designed to identify bacteria causing severe infections, like bacteremia and meningitis. It would look at the symptoms and test results and recommend antibiotics. It even adjusted the dosage for the patient's body weight. The name mycin actually came from the antibiotics themselves, because many antibiotics end in mycin, like erythromycin. Okay, not the most creative name, but it worked. Mycin was developed at Stanford University starting in 1972. And here is the crazy part. In studies, mycin actually performed better at diagnosing and recommending therapy for certain infections than human doctors. No cap. It was a flex. It laid the foundation for everything we have today. But there was a massive catch. It was what we call brittle. It lacked common sense. If you gave it data that was slightly outside its narrow focus, it would just glitch out or give terrible advice. Plus, this was the 70s, so computers were the size of rooms and slower than my grandma trying to send an email, so it never actually made it into real clinical practice. But it proved the concept. It showed us that machines could handle high-level medical reasoning, and that is honestly pretty fire when you think about it. So, back to the future. We have come a long way since Mycin. Today, AI is touching everything in healthcare. It is not just diagnosing infections, it is developing treatment protocols, it is helping with drug development, it is doing personalized medicine, it is monitoring patients remotely. The Cleveland Clinic and other major institutions are all over this. They are using AI to improve patient care and research. We are talking about AI systems that can assess cardiovascular risk better than old school calculators. We are talking about preventive screenings that actually catch things early because the AI sees the risk profile years before a human would. But let's talk about something that affects the actual meds you take. Drug discovery. Usually, bringing a new drug to market takes forever, like 10 to 15 years and billions of dollars. It is insane. AI is shrinking that timeline. Startups are popping up everywhere. According to recent stats, about 30 AI startups are working specifically on clinical trials right now. Some are collaborating with big pharma. They are using AI to find the right patients for trials faster. They are optimizing the trial design so they do not waste time on drugs that are not going to work. This is huge for real. Think about personalized medicine. This is the holy grail. Instead of a one-size-fits-all pill, imagine a treatment plan that is tailored specifically to your genetic makeup, your lifestyle, your environment. AI can analyze your genome and predict exactly how you will respond to a specific drug. That is high-level stuff. It is transforming healthcare from reactive to proactive. Instead of waiting for you to get sick to treat you, AI helps keep you from getting sick in the first place. But hold up. Do not go thinking it is all sunshine and rainbows just yet, because we have some major red flags to talk about. And if you have been listening to the Artificial Brain for a while, you know we keep it 100 here. We gotta talk about the failure. First up, let's talk about the vibe check. A systematic review and thematic analysis in 2023 dropped a truth bomb. It showed that most stakeholders, including health professionals, patients, and the general public, have doubts. They do not think care involving AI can be empathetic. And honestly, that is valid. I do not want a robot telling me I have a serious illness with a monotone voice. I want a human who gets it. Empathy is a huge part of healing. It is the bedside manner. Can AI simulate that? Maybe. Can it actually feel it? No. And patients can tell the difference. There is a trust gap. If you do not trust the tool, you will not use the tool. That is a major hurdle for adoption. Then we have the technical issues. Meta-studies have found that the scientific literature on AI in healthcare often suffers from a lack of reproducibility. That is fancy talk for, we cannot make it work again. A company releases a study saying their AI is 99% accurate, but then other researchers try to replicate those results and fail miserably. That is a problem. In healthcare, you cannot afford to have results that only work one time in a lab. You need consistency. There is also the issue of AI being put to work without proper testing. Sometimes, venture-backed startups are moving so fast, trying to grow quick and make that bread, that they skip the rigorous validation steps. The healthcare system is naturally slow because it is risk-averse. You do not want to experiment on patients. So there is this massive tension. Tech wants to move fast and break things. Healthcare wants to move slow and not break people. When those two collide, it is messy. And we cannot ignore the ethical hurdles. Oh boy, where do I even start? Let's talk about algorithmic bias. This is a huge one. AI models are trained on data. If the data is biased, the AI is biased. It is garbage in, garbage out. If an AI is trained mostly on medical data from white men, it might be terrible at diagnosing heart attacks in women or people of color. This has actually happened. There have been cases where AI algorithms used in hospitals to allocate extra care resources ended up discriminating against black patients because the training data reflected systemic racism in healthcare access.
Meow.
That is not just a glitch, that is dangerous. It amplifies already existing inequalities. So we have to be super careful about how we train these models and who is represented in the data. If the AI is not trained on a diverse population, it is going to fail for that population. That is a fact. Then there is data privacy. To make these AIs work, they need massive amounts of data. Your medical records, your genetic info, your location data. It is sensitive stuff. If that data gets leaked or hacked, that is a disaster.
Bruh.
And let's be real, companies love data. Sometimes they love it a little too much. There is a fear that healthcare data could be used for things other than healing, like insurance companies trying to deny you coverage because an AI predicted you might get sick in 10 years. That is the kind of dystopian scenario that keeps people up at night. And last but not least, jobs, automation. Will AI replace doctors? Probably not entirely, but it will change the job. Radiologists might spend less time looking at scans and more time managing the AI that looks at scans. Some tasks will definitely be automated. Healthcare leaders are resisting this change because it is scary, it is new, it requires retraining entire workforces, it costs money. So adoption is slow and erratic. Let's take a moment to zoom out and think about where this is all going, because despite the red flags, the potential is undeniable. A survey by HIMSS found that 86% of healthcare organizations already use AI in some capacity. That is wild. Over 73% of health execs plan to invest even more. The train has left the station. We are looking at a future where your smartwatch monitors your vitals and alerts the AI at your hospital before you even realize you are having a heart issue. We are looking at a future where clinical trials recruit patients in days instead of years, speeding up cures for cancer and Alzheimer's. We are looking at a future where personalized medicine is the norm, not the exception. But we need to be smart about it. We need to demand transparency. We need to demand that these algorithms are tested rigorously. We need to ensure that the data is diverse and that the biases are checked. We need to figure out how to integrate the human element, the empathy, the care, into this high-tech world. Because medicine is not just about fixing broken parts, it is about caring for people. So, is AI in healthcare going to be the savior we all need, or is it going to be a chaotic mess of bias and glitches? Honestly, it is probably going to be a mix of both for a while. We are in the awkward teenage years of medical AI right now. Growing pains are real, but the direction is exciting. I want you guys to think about this. Would you trust an AI to diagnose you if it was 99% accurate but 0% empathetic? Or would you rather see a human who might make a mistake but at least cares? That is the trade-off we are looking at. It is giving cyborg future, but we gotta navigate it carefully. That is the scoop on AI in healthcare for today. From the early days of MySkin to the bias issues of today, it is a wild ride. If you found this interesting, or if you just like the meme sounds, do me a favor and share this episode with a friend who is low-key obsessed with tech. We have got more fire episodes coming up. We are going to be diving deeper into the tech that runs the world. You do not want to miss it. I am Shining, and this is the Artificial Brain. Stay curious, stay safe, and maybe get your vitamin D levels checked. Peace.
Emotional damage.